Now we'll talk about another fungal infection in the body. All right, and us discussing this in orthopedics. Orthopedics definitely you know that there's kind of like orthopedic manifestation of it too. So it's always good for us to discuss all these things around. So you can have abscess after some time could affect the jawbone. Do you understand? So actinomycosis, okay, sorry, it's not a fungal infection, it's actually a bacterial infection. It's a bacterial infection. It's a chronic bacterial infection and it's usually caused by what? Actinomyces what? Israelii, which is a positive anaerobic bacteria that normally lives harmless in the mouth. It can live in the gastrointestinal tract, it can live in the female genital tract. But due to some one or two factors, it becomes harmful. Do you understand? So I was talking about mycosis being fungal because the name mycosis. Do you understand? I felt it was actually a fungal stuff. So types of actinomycosis, we have the cervicofacial, where you have abscesses around the face. Most commonly, affect to your dentals because it lives in the mouth. So if it becomes harmful, it affects your mouth first. So jaw swelling, abscesses, draining sinuses. We have thoracic what actinomycosis. This one could affect your lungs, affect your chest wall, and you feel as though the person has tuberculosis or even lung cancer, but it's not lung cancer. We have abdominal actinomycosis. This one could lead to what? Perforations of your abdomen. We said that the bacteria also lives in the gastrointestinal tract, right? They also have the pelvic actinomycosis. Do you understand? So that one usually comes in after the person has used an intrauterine device. So mostly in women, those intrauterine devices that we actually use, uh, we use them, to prevent pregnancy. Use them for a very long time, then you know actually brings up that. So you could see this is the oral one. So symptoms is there's a firm, slow growing swelling of mass, then also abscesses with a draining sinus. There's pus containing yellow sulfur granules, which is basically the clusters of the bacteria. Low grade fever, weight loss, and malaise. So symptoms depend on the site. Do you understand? If it occurs in the jaw, of course, you're having issues of swallowing, chewing. If it also occurs in the chest, you're having issues of breathing. In the abdomen, issues of, intestinal perforation. You're not being able to eat very well or digest food. Diagnosis is microscopy and culture. You try to pick up some, samples to identify the Actinomyces species, histopathology, and also imaging to just see how the extent of damage. Treatment is antibiotics, so high dose penicillin is the first thing there. So second thing, you are looking for doxycycline, um, erythromycin, clindamycin, also surgeries where you try to drain the abscess. You also try to excise the sinus tract. You also try to remove the necrotic tissues.